Hey guys, my name is Ben. I'm that PT guy, and today I want to talk about some interventions that you can implement prior to total knee arthroplasty surgery. I'm going to go over everything that you need to know, including the exercises I use, the stretches I use, and the techniques I use to get range of motion for individuals that come see me prior to this surgery. So let's go ahead and dive right into this full guide. The first thing is talking about when to start these exercises, and we want to start these exercises at least 6 to 8 weeks prior to surgery. That will give the body plenty of time to build strength, to improve flexibility, and hopefully improve range of motion as well. It's important to note that I recommend strengthening exercises at least 3 times a week. I also would like to stress the importance of keeping up with the flexibility exercises at least every day, preferably twice a day. Now, there are some major goals that we want to talk about that we would like to accomplish prior to the surgery. Number one, we want to improve quad strength. The quads are severely inhibited after these surgeries, and they are a big reason why people have a lot of issues after surgery. Without quad strength, it's very difficult to go up and down stairs efficiently. It's difficult to walk normally. And so the quads are very important when it comes to our functional activities that we do every day. And we want to also stress the importance of improving our overall cardio endurance prior to surgery. This will help with the rehab process afterwards if our cardio threshold is already up prior to surgery. We want to improve range of motion in both flexion and extension. Some individuals may have more difficulty with flexion or extension depending on where they are with the degenerative processes in the knee. But depending on where they're limited, we want to improve those the best we can. The number one factor that is going to indicate where we get range of motion after surgery is the range of motion we had prior to surgery. And so it's vital that we try to improve range of motion as much as we can prior to the surgery. We want to improve the flexibility of the hamstrings, the calf muscle, and the quad. We want to really try to strengthen up those muscles as well. All those muscles that attach below and above the knee joint, we want to make sure that they are moving correctly, that they're flexible enough, and that they are good and strong prior to surgery. We also want to take a minute today and talk about some modalities that can be used for pain management. Many times individuals wait to have these surgeries until they possibly cannot take it anymore and the pain is very severe. We also want to talk about the importance of not pushing through severe pain with these exercises. Again, if this program is starting 6 to 8 weeks prior to surgery, the individual needs to be able to tolerate that amount of exercise. And so it's important to let pain be the guide with these exercises, not pushing through severe pain and just doing what can be tolerated. Let's talk about some modalities for pain. And there's many out there that don't require a physician's prescription. You can use heat and cold. It really doesn't matter which one. They both serve the same purpose with pain control. You can use a TENS unit. These have become very common and are available at many drugstores. You can get them on Amazon for $35, $40. You can get a very good one. There's many topical agents that can be used for pain. BioFreeze is a very popular one. You can usually get those at Walmarts and Targets and other stores like that. And then, of course, you can get NSAIDs over the counter as well. However, it is important before taking these medications that you seek out a physician first. There can be drug-to-drug interactions, even though these are over the counter. So be sure to do that before taking any medication. Let's go ahead and take a look at some flexibility exercises I like to implement with people who come in prior to total knee arthroplasty. So here we have a hamstring stretch. And so you're going to lay on your back, you're going to put your hands behind the knee, you're going to point your toes up towards the ceiling, and then you're going to fully extend the knee till you feel a stretch behind the knee and the hamstring muscle group. You're going to hold about 2 to 5 seconds, then you're going to return to the starting position and rest 2 to 5 seconds. And you're going to repeat this process 10 times. Again, with these flexibility exercises, I recommend twice a day if you can. Next, we have a calf and a hamstring stretch. You can stretch both of these muscle groups at the same time. All you need is a long towel or a belt. You're going to put whatever you're using around your foot and gently pull towards you until you feel a stretch in your calf muscle or hamstring muscle. Hold about 10 to, I'd say, 30 seconds, somewhere in there. You're going to do about 3 to 5 repetitions. And again, we're looking to do this about twice a day. Now here is a great exercise to work on your range of motion. What you're going to do is you're going to use the leg that you're not going to have surgery on to do all of the work for you. So in this example, it is the left knee that is being stretched. And so you're going to use the other leg to go behind the leg that is looking at having surgery. You're going to stretch that leg into full extension, hold about 5 seconds, gently lower back down to neutral. Then you're going to put that leg over top of the leg that's looking to have surgery and push underneath you into full flexion, hold 5 seconds, and then repeat the process back and forth like the video here is showing. Again, you're looking to do about 10 of these, holding 5 seconds or so at end range, again, twice a day if tolerated. To improve cardio, I recommend if you don't have a gym, you can get a little device like you see here on the left. They are very low profile. You can put them under a desk, you can put them by a chair. And this is a great way to start building some cardio. You can even put these up on a table and use your arms if your knee is too painful to tolerate this exercise. And that way, at least you can build your cardio endurance up. If you do have a gym membership, you can, of course, use a stationary bike. New Steps, which is the device that you see there on the right, those are great low impact machines that can improve range of motion and endurance as well. Now we're looking to try to get to at least 10 minutes with these, but start where you are. If you can only tolerate 6 minutes, that's okay. Try to build up a minute per week, and that will greatly help you after surgery, having your cardio fitness levels high and ready to go after surgery so you can hit the ground running with rehab. To build strength, here we have heel and toe raises. These will help those muscles that are in around your shin. And we are looking to be able to do 2 sets of 10 of these exercises, a slight pause at end range there, again, at least 3 times a week for the strengthening exercises. Now we have long arc quads. Here, you're going to sit in a chair, you're going to extend the knee out fully, hold 5 seconds, and then slowly lower back to the floor. Again, we're looking to do these 3 times a week at minimum. I would start with 10 repetitions here and build yourself up to be able to do 2 sets of 10 if tolerated. Next, we have mini squats. Here, I'm doing the mini squats with a chair behind me. If you don't feel comfortable doing this, you can find a countertop to hold on to with a chair behind you. And if this is too painful in the knee to go into a deeper squat, just go where you can. And it will still be beneficial even if you're not going into the squat deeply. Again, we're looking to try to get up to 2 sets of 10, at least 3 times a week. Here we have straight leg raises. You can do these on the bed, on the couch. You do not have to do these on the floor. But to do these, you're going to bend the side that you're not exercising. You're going to straighten out your leg, and you're going to lift it no higher than the other bent knee, and then slowly back down. Again, trying to get to 2 sets of 10, 3 times a week. Here we have a bridge. You're going to bend both knees as much as you can. If this is too painful, don't worry about doing this exercise. But if you can tolerate bending the knees to this position, you're going to push your bottom off the whatever surface you're laying on, and then slowly back down, again 3 times a week, shooting for 2 sets of 10. Here, if you can lay on your side, you're going to straighten out the top leg. You're going to lift it up into the air, pause, and gently lower it back to the floor. Again, with all these strengthening exercises 3 times a week, 2 sets of 10 is the goal, but start where you are and where you're comfortable. And it's important to note, if any of these exercises cause discomfort to the point where it's so painful you don't feel like you can do them, do not push through these exercises. Again, the disclaimer in the beginning, I am a licensed physical therapist, but I'm not your physical therapist. And so always seek out a professional before starting any exercise routine. Okay, so this brings us to the end of this total knee arthroplasty prehab guide. I hope that you found it beneficial. If there's anything that you would like to see in future videos, comment below on some things that you'd be interested in. I'm always looking for new ideas, and this is a newer channel, and I hope to hear from you real soon. Thanks for watching.